Hello everyone. In this video, I'm going to tell you about dengue and its management. The vector is Aedes mosquito caused by dengue virus. The symptoms of dengue fever are rashes, fever, retroorbital pain, body pains. When patient comes with these symptoms within 5 days, then diagnosis of dengue is made by NS1 antigen test. If patient presents with these symptoms after 5 days, then the diagnosis is made by IgM antibody testing. After 5 days, there is no use of testing the NS1 antigen because it gets disappear after 5 days. So after 5 days, IgM antibody testing is done. Within 5 days, NS1 antigen test, and after 5 days, IgM antibody testing. Before going to the treatment of dengue, we need to know the types of dengue. Simple dengue fever without warning signs, dengue fever with warning signs, which is dengue hemorrhagic fever, and the third type, most severe type, is dengue shock syndrome. In simple dengue fever, symptoms like fever, retroorbital pain, body aches, and rashes are seen. In dengue hemorrhagic fever, there is leak of plasma from the capillaries, so there is rise in hematocrit value. This is the differentiating feature for dengue hemorrhagic fever from simple dengue. The hematocrit value rises more than 20%. In this dengue hemorrhagic fever, there is decreased platelet count, liver enlargement more than 2 centimeters, severe abdominal pain. These are the symptoms seen in dengue hemorrhagic fever. When it comes to dengue shock syndrome, elevated liver enzymes, ALT, AST are elevated more than 1000 international unit per liter. And if any renal or CNS involvement, then it is called dengue shock syndrome. The patient is usually in shock, decreased perfusion to organs. So, now let's talk about the treatment. In simple dengue fever, where dengue without warning signs, oral fluids like ORS, coconut water, fruit juices are enough. No need of hospitalization, and for body ache and all, a simple paracetamol tablet is enough. And in dengue, NSAIDs are contraindicated, ibuprofen contraindicated. In dengue hemorrhagic fever, when you see there is increased hematocrit more than 20%, that means there is increased hemoglobin. Increased hemoglobin or increased hematocrit value in dengue patient is not a good sign because there is leak of plasma from the capillaries. Because of that plasma leaking, there is increased hematocrit or hemoglobin value, which is not a good sign. So the treatment in dengue hemorrhagic fever is you have to admit the patient and give him IV fluids and paracetamol. IV fluids are stopped when SPB, systolic blood pressure, comes to normal, or when it is more than 100 mmHg, you have to stop the IV fluids. Till then, you can give IV fluids. And when to discharge the patient? Usually, there is no need of any platelet transfusion. In dengue hemorrhagic fever, there is decreased platelet count, but Platelet transfusion is done only when platelets are less than 10,000. Only when less than 10,000. Only that time you have to give the platelets. Until then, no need of platelets. When to discharge patient? Discharge protocols of dengue are patient should be free from fever for at least 24 hours without any antipyretics. And patient should, if the patient had dengue shock syndrome, and patient should be shock free from at least 2 to 3 days after recovery from shock. And platelet count while discharging should be at least more than 50,000 cells per millimeter cube. Stable patient when normal BP, systolic blood pressure at least more than 100 mmHg, return appetite, and normal urine output. Only in these conditions you have to discharge the patient. In cases of dengue shock syndrome, also, the treatment is same, just IV fluids and paracetamol. Fluids should be stopped even if systolic blood pressure comes to more than 100 mmHg. There is one question in AIMS. This is the question. A dengue patient who was admitted hasn't had pyrexia in the past 24 hours. He had a healthy appetite now. Blood pressure 110/70. Hematocrit is 44%. Total leukocyte 4,000. Platelet is 34,000. When he blows his nose, he experiences epistaxis. What is the best treatment they're asking? So, if you see this question, we can easily say what is the answer because here, if you see platelet count is 34,000. I already told you platelet, that's plasma, this is platelet transfusion. Platelet transfusion is done only when platelets are less than 10,000. So, based on this, we can easily tell that in the correct option, B should not be there. In every option, if you see, out of four, three options had B in it. So this not the answer, only C and D. If they had given A, C, D, then what would you choose? IV fluids. IV fluids also should not be given in this patient as the BP is 110/70. As I told you, when systolic blood pressure is more than 100, you should stop IV fluids. If you give IV fluids continuously, there is a risk of getting pulmonary edema. So IV fluids are also not needed because he also doesn't have any pyrexia for past 24 hours. So no need of giving IV fluids. Even though they give A, C and D, A should not be there. C and D, reassurance and observation, plenty of oral fluids. That is enough. When to call severe dengue? Severe dengue is when hematocrit is rising more than 20%. Renal or CNS involvement. CNS involvement. Platelet count less than 10,000. Shock signs. These are all come under severe dengue. Anyway, the treatment is IV fluids and the monitoring of platelets. There was one more question in INICET. A patient is in dengue hemorrhagic fever stage. What would you monitor? The options were hematocrit was in one option and platelet count was also in other option. So in dengue hemorrhagic fever, you will monitor hematocrit or platelet. I mean, main monitoring is to be done for hematocrit value only. It's not about platelets. Platelet count may be decreased in simple dengue also, but the main characteristic feature of dengue hemorrhagic fever is the leakage of plasma. Because of that leakage, there is raised hematocrit. So in dengue hemorrhagic fever patient, you should monitor hematocrit. It is more important than monitoring platelet count. So the single most answer and the best answer is hematocrit value. Dengue doesn't need any complex treatment. It just need fluids and there are certain tests like a tourniquet test. It is useful in differentiating decreased platelet count. Like it differentiates a simple dengue versus a dengue hemorrhagic fever or a dengue shock syndrome. Actually, we have to check the BP of the patient. And for example, if the systolic blood pressure of the patient is 120 and diastolic was 80, this is example. You have to take the mid value between 80 to 120, for example, 100. So inflate the cuff till 100 and keep it in inflated state for 5 minutes or 2 to 3 minutes. After that, deflate it and wait for 1 to 2 minutes. Then you can see tiny papule like things, uh, point papules below the cuff more than or 10 per square inch as diagnosis of dengue hemorrhagic fever. Thus, the papules are occurred due to because there is decreased platelet count. This is one tourniquet test. The last tourniquet test is used in identifying which disease it is dengue. That's all about dengue. Thank you.